Today is the first day of winter, and with the seasons changing, so could your allergies. So joining us to talk about the most common ones and a new way to treat one is Dr. Sabrina Fabi. All right, Dr. Fabi, thanks for being here.
Thanks for having me, Jen.
All right, so some 50 million of us have allergies. Talk to me about some of the most common ones that you see, and how do people in the first place even develop allergies?
Right, so 30% of the adult population in the U.S. has allergies, 40% of children have allergies, and they can be to foods. Common ones include peanuts, eggs, milk, but you can also have it to dust mites, cockroaches, as well as to drugs. So you can have allergies to many different things, whether it's food, drugs, or even just good old things that we have in the air.
Right, so what do you think is the best way to treat them? Like, do you power through the ones that, for example, like the dust or the pollen ones, or is there more medicine out there that people should be taking?
Right, well, you know, it's funny, you sometimes may develop these allergies later on in life. And so because of this, many of us are taking antihistamines. And so although there are so many people that have allergies, we really haven't come far with medications for allergies. We're treating people with antihistamines like Claritin or Benadryl. But unfortunately, when you take these medications, they also can make you a little drowsy. They can dry up all your sinuses, and they can dry your eyes and your mouth. Also, there are immunotherapies or steroids, anti-inflammatories that can be written as prescriptions that can also help clear up your nasal passages and not make you so stuffy and maybe not make you so teary-eyed. But really, it's preventing contact with any of these allergens, which is sometimes hard to do and unavoidable, especially if you come into contact with cats, or if you're here in San Diego all year long and you have pollen and dust all year long. And so because of this, researchers are looking into different medications that can be more targeted towards the actual allergen. And the newest of these medications is one's actually directed towards peanuts, because peanuts, as we know, if we give this to a baby, they can go into something called anaphylaxis, where everything closes off, including your airway, and it can be potentially lethal. And so this new medication, which is in phase 3 clinical trials, actually gives a subject, which will ultimately be a human, a little bit of this protein in the peanut in a pill form. And it's called desensitization therapy. And so over 6 months, you expose the patient to a little bit more and more of this peanut, and so that eventually they can consume an entire peanut and no longer have the allergy.
Wow, that is fascinating. I remember when I had my daughter, her pediatrician actually said the earlier you start introducing highly allergenic foods, i.e. peanuts, eggs, things like that, obviously when she was old enough to start eating solids, the less likely she would be to develop allergies, which was kind of the opposite of what doctors had said for so many years. Do you find the same thing?
I do, because then your body is not strong enough to mount such an exuberant response to whatever that allergen may be. And if you have asthma or eczema, you are at greater risk to actually develop some of these allergies. And so now they're looking at some asthma drugs to help you get through some of these allergens as well. So it's quite fascinating. I think one day we're actually going to be seeing gene therapy, because there are genes that make you more likely to develop allergies. So if you block those genes, then you may no longer have those allergies, which would be great for me.
Right, yes, and we've done so much advances in DNA mapping. You could see that that would be sort of the next path. Dr. Fabi, thanks for being here. Appreciate it.
Thanks for having me, Jen. Happy holidays.
Thank you, you too.